Well, it really was something that came up after we had done our first couple of rounds of funding. We didn't hear from the FDA until we were well beyond launch. So we did hear through some of the investors that they probably wouldn't have invested given the regulatory climate that developed. And of course, hearing from New York and California, and then actually, I don't know if it's ever changed in Maryland, but I still don't think you can buy a kit in Maryland. So the challenge is all the different states have different laws, and then you've got the federal government stepping in, and it takes a lot of time to sit down and talk with them. But as I said earlier, we just made the conscious decision that we were not going to change our platform, and we were going to stick to that and then just go and do the hard work of sitting down with all of these people and discussing it. And actually, the state of California meeting was really interesting. It turned out it was the 5 women on the state of California on one side of the table, and then the 5 women from 23andMe on the other side of the table. There was one guy who was a lawyer there, but we just, and it was nice because the woman who was leading up the Department of Health side, she was probably a woman in her 70s, and she just said, and I think it was partly because we were all women, and she just said, let's work this out. What you guys are doing makes sense, and I really can't see a reason why you shouldn't be able to do this. Yeah. So it was actually really reassuring. New York was a completely different story, and still is. But we just felt like fundamentally it is a person's right to have access to their own data, and we would just not want to back down from that.